Good evening, friends. Today we are going to discuss difficult situations for a surgeon which he has to communicate. It is possible that the situation we want to discuss may be difficult because of an unexpected accident has happened, a complication which was not thought and discussed with the family has happened, somebody has died suddenly, and we are talking to a difficult person. A lot of times the situation may not be serious, but the person may be serious. It may be. Now, as an anticipatory skill, I would like to share which patients are likely to be troubleshooters for the surgeons. Whenever it involves a young male child, a road accident critically injured young fellow, when it is a person who is politically connected, people associated with law enforcing agencies, police, advocate, judiciary, and the very rich patients. To summarize, the very rich and the very sick are the people who demand attention. It is these people who need to be handled, what I call it as, put a tag on their chart, glass handle with care. Otherwise the things will go fragile. So, with this background, looking into which people are going to create trouble for you, what sicknesses, an important issue is that when somebody is alcoholic, most alcoholics and drug addicts are young people. They have exhausted all their funds which they had, and now there are no attendants, nobody is interested to look after them. But in case an eventuality happens, if a complication happens, 100 people will gather with you. What is important is we talk to all these patients and their attendants on everyday basis. The time spent on their patient care management may be less at times. And an important message is who should talk to the family. The available senior most person in the unit should be there. Good evening, Professor Malik. The best person available in the unit, the available guy who can talk the best, should communicate with the family. One important lesson for youngsters is never talk in the corridors. Never talk when you are walking, because when you are walking in the corridor, a family member may suddenly speak something unpleasant. He may suddenly say a word which pinches you. All of us are not emotionally that mature to handle an abnormal dialogue. I will come to that in the latter part of this lecture. That if you are seated in a room and the attendants are seated across the table, the chances of having a heated dialogue is less often. Communication in anticipation is the single important feature. A patient who has recovered, let me share with you a small story. How I decided this topic is based on some real life happenings. We had a gentleman in our unit who had been with us for 6 weeks on ventilator because of chest trauma. Repeatedly, the family would ask, "Doctor, how many more days will he take?" My answer always is, look, if you ask me, are we doing our best? Yes. Can I do something better if he was my real brother? The answer is no. How many days he will take to be weaned off the ventilator? Again, my answer is, I don't know. It can be 2 weeks, it can be 1 week, it can be any number of days. Welcome, Professor Call. So, the point which I want to say, we are not discouraging the guy, but at the same time, I'm not putting any deadlines. Because when the 7 days, if you speak 7 days, then after 7 days, the family will be angry. But whatever be the situation, when we find the patient is not recovering as per the family's expectation, most of the time it is we or somebody in the team who has created expectations. Some of our friends give an ad in the paper, gallbladder discharged less than 24 hours, hernia 1 day. Now when that suddenly 1 day becomes 10 days, it is very difficult to do that. But can we tell everybody that it will take 10 days? Then no hernia will get admitted. So it is good to be polite and diplomatic at the first time, and in the pre-operative visit only, explain them. If I have to say so, I would say most of my hernias go home on day 1. I will give a pause. I would say some of them may take 1 week. We do everything best for everybody, but the body reaction, the resistance and the luck and chance of every patient is different. I have control over my factors, but I will see that I can help him to get recovered fast, but at the same time, I cannot guarantee anything. Well, if on saying this, some patient doesn't want to be operated by you, let him go. Do not promise. Better to have 1 case less than lose your sleeps and face the court every now and then. It is better to earn a shade less, but eventually in long run you will earn more, because such people would not be satisfied anywhere else also. Now with this background, I am trying to create some of the real life situations. I will start from smaller issues and we walk down our journey to the more difficult issues. Now, sometime it may be that it is my fault. Let me exemplify that. I told the family I will do the dressing. I didn't turn up. Now, this is some of the very minor issues. If it is so, the family says, oh, our father is waiting since morning, we were waiting for you to tell, then there is absolutely no shame in telling, and I do it quite often. I will tell the family, Sonny, I'm sorry, I got busy in another serious emergency. I will do it right now. And by saying one word, the whole issue gets buried. Well, there may be a situation where it is not my fault. I ordered an ultrasound in the morning, but till evening round, the ultrasound could not be done. Again, the family would get heated up at me. Our father is fasting since morning. Nobody has done the ultrasound. Now here, I don't need to say sorry. I would say, dear friend, let me look into it, why it hasn't happened. But I'll make sure it will happen very soon. What we need to inculcate an art is we do not react back to the family. And similarly, The similar situation can happen within the unit. I tell my lovely, obedient junior consultant, brother, make a discharge detail card for this gentleman and it should be ready by afternoon. Now when I go for the rounds, the cards are not ready. If it happens once, ignore it. If it is happening again, I would again not react to my team member. I will say, look dear, we need to sit down and talk over this issue. This cannot carry on for indefinite time. You see, when we get angry to an external reaction, I am allowing my emotions to be controlled by another person. I should have the right to control myself. How can I let somebody else control my emotions? Once we lose our temper, who is going to suffer? We ourselves, not the person who has created the situation. Well, if somebody has suffered a loss, let me say a patient, I'm making the situation easier. A patient with terminal metastatic cancer has expired. The family understands I have not played any role in that. They were well informed about it. But whenever somebody has suffered a loss, the sensible thing is when you approach such a family and when you talk to them, if you are elderly, you can keep a hand on his shoulder. You can give a gentle hug and say, oh, I'm sorry. I can understand your loss. If somebody's dead, he may be 88 years, he may be 95 years. But as far as that person is concerned, that family is concerned, the loss of a member at any age is important. And one sympathetic word, a gentle body language can cool the whole thing. Within the team, if we have a difference of opinion, I work in a hospital where there are so many other bright consultants, some young GI, urologists, plastic, pediatric surgeons, and suppose I do not agree with whatever statement on management they are giving. My medical superintendent does not agree with what I am trying to say. I want my emotions not to be controlled by anybody else. So do I want for my young surgeons, that their emotions should not be controlled by anybody else. So how, if ever you want to differ with somebody of your age or somebody a step ahead of you, good evening, Dr. Mishra. So ahead of you, then the method is simple. You don't say, no, this cannot happen. No, when you say no, never, but, I repeat, no, never, but. These are the words which reflects a confrontation attitude. Hence, what is the right way? The right way would be something like, I would love to agree with you on this issue. You see, you start with a positive note. I repeat, I would love to agree with you on this issue, Dr. Saurabh, but I think the management should be 180-degree in the other direction. So I have conveyed him my thought of dissent, an absolutely other way management. At the same time, I have not started the dialogue which could be insultive to him. If it is one of my senior colleagues, I would always very smilingly said, sir, we can be best friends. You can use this dialogue, and believe me, There will be always a pleasant environment. I would say, sir, we can be best friends and differ in our thoughts in management of this patient. And as far as I'm concerned, I will do a laparotomy on this patient's stat. You may think to wait for a while. Hence, whenever we are giving a note of dissent, when I am disagreeing with somebody, it does not mean I have to insult him. Hence, I repeat, no, never, but are insultive words. Whereas, however, unfortunately, may not be, is accepted in a more pleasant situation. Now, we may be facing difficult people. When you have difficult people, difficult situations, we cannot get away from the situation. We have to have our own emotions under control. Now, I will give you an example. You have come late on rounds. Your boss says, you are late. Then after a bit pause, he says, you are always late. Now, you know you have been late first time this week. Can you confront him back? He will confront you back. And what will happen? You will spoil your mood forever. Now, most people, if you follow some reading, some videos, everybody says on such difficult situations, you may count between 1 to 10. Is it humanly possible? I will give you another example. You've done a gastrojejunostomy in the morning as a first case. Around 1 o'clock, the patient started massive reactionary bleed. You had to re-explore the patient. On one end, the family is on your head. That, what the hell did you do on the surgery that the patient needs a second surgery on the same day? Your medical superintendent tells you, who is going to give the bill for this patient second time? They have not deposited even the first money as yet, completely. Now, with difficulty pursuing the anesthetist, running to the blood bank, you arrange blood. You are under fire from all the sides on a bad day. And then you are pushing through daily traffic from here and there, and you reach home late. And when you reach late home, your spouse tells you, you are late. You are always late. Now you can also yell back and say, you can't understand how tough the day I had. There were so many problems here, there and everywhere. If I am late, how does it matter? Then the other person says, you're always late. Then you yell back again, oh, Tuesday and Wednesday I was in time. No. Can you count 1 to 10 at that particular moment? No. You have worked up a patient for a LAR. Then suddenly the family comes back. They were with you. They got a biopsy done, the MR and CT done. And when everything was ready, then the family says, doctor, you are very expensive. Now, any human mind will get upset. And dear friends, if you want to live with peace and comfort, you have to learn how to have your cool at such events. You cannot count 1 to 10. So let me share with you a formula. You repeat back the same dialogue to the other person. If somebody tells me, you are a very expensive doctor, my answer would be, Dear sir, I agree with you. I agree with you that cost is your concern. I'm not saying that I agree with you, I'm an expensive doctor. I'm not saying my 90% friends in Delhi would say, then why are you here? Go to a government hospital, get in the line of GB Pant, as and when your turn comes, get operated. Not like that. I agree with your concern regarding finances. I understand you have financial limitations. Let me see how can I help you. Let me talk to the admin. Well, even if that patient doesn't get operated from you, he will not leave you with a headache. If somebody tells me I'm late, I would, with a pause, say, I understand I am late. Be polite, be slow, be emphatic. I understand your concerns that I'm late. The human mind is such, if somebody is going to repeat the same question back, it is registered that the other person understands what my issues are. And that is the time you can think over what next you are going to tell. Now, it is when we communicate to anybody, less than 10% is the words, 35% is the character of your voice, and half of it is body language. It's the words do not matter that much as the body language and your tone and your style of saying matters. Now, let me share another real life story. This morning, the residents who were with me in the morning rounds on a Sunday, I spent time and I took them along with, and I said, look at this operation which you may not see again. We had an alcoholic in the ward which was neglected by the family. So morning around 8:30 I called up because there was no attendant overnight with him, and I called up. His son picked up the phone half asleep, and he was howling, why did I wake him up early morning on Sunday? I just forgot about him because I thought most drug addicts and alcoholics are not taken care by the family. As I walked out of the ward, after 15 minutes, his wife appeared on the scene. Furious looking middle-aged lady, and she said, by pointing a finger at me, she said, I want to talk to you urgently. I just looked at her and said, oh, Mrs. X, I understand your concerns, but try to understand, like I spend time on your husband, I need to look after a couple of more patients and then we meet. She said, no, I want it right now. I said, well, right now we cannot talk in the corridor. So I pushed her into one of my offices. I said, I'll come there. So on the way, I anticipate things out of my lifetime experience. Even when you're a young guy, do not talk to anybody when the person is furious. Give him some time, give him a place to sit and wait. Even you had finished rounds, meet him or her after 5-7 minutes. The human mind cools down. The adrenaline rush goes down. Because she came running from home, and her concern was, why did I wake up her son? For the sake of his father. Probably she was expecting that I should call on her number. Now when I came, we sat across the table, and in my Lucknowi style, I told that lady, Tashrif rakhiye. When you tell somebody, please be seated, have a seat, would you care for a glass of water? The things start cooling down. Now, I am not cooling her down because I am scared of her, or any one of you should be scared of an attendant. But the point is, I didn't want to spoil my Sunday. So hence, I play this game, and I advise you guys to play this game for your better mental health, for you to be comfortable. So I sat down with minimal smile on my face and I said, yes, tell me what are the issues. And she started that I'm from Mumbai and I got married to this joker 30 years ago, and he has been an alcoholic, he had given no money, and all the problems he had, which were unrelated to necrotizing fasciitis, which my unit was treating. But then, if you want to be successful, you have to be a good listener. So I kept listening, and in the end, when she finished, actually, I had called her to tell her that the family is not taking care of him and things will get difficult. But when I realized the real story, I quickly changed my mind. And I said, well, this morning I called you up for a good news. She said, what is good about it? I said, your husband is better. He's going home today. She said, if he goes home and he drinks again? I said, then Lord Jesus also can't help him. That is your duty to take care of him. So, we can manipulate the discussions to prevent an ugly turn in such situations. And I also said, I agree with you. Now, I have appreciated when I start such communications, we start always like this, that you have, even the guy who never cared for his father, a perennial boil, became necrotizing fasciitis till the bad foul smelling state, 10 days they neglected. Now when I start with such a character, I would say, oh, you have been a wonderful son and a family, and you love your father so much, and you took care of him so much that you brought him here. Now this joker thinks quite great about himself foolishly. But who am I to take out a fool from his paradise? Let him grow in that. When public is getting against us, we need to be pleasant. My dialogues will not harm the patient, but if it keeps some foolish man happy, let him live in happiness. Hence, soft communication, listening nicely, talking sensible, to the point, politely, takes away a lot of things. And after every episode, we need to analyze, what did we learn from this case? How could we deal the similar situation better next time? And what is important in life is, we have negative people, we have foul talking families and relatives. If I put a board outside, only MA English and above from Miranda House should come to my OPD, then maybe I will be seeing one patient an alternate day. I cannot select my patients, I cannot select the crowd. The crowd has to come as per the ratio of Indian population. Wherever you practice, either it's me or you, is going to be the same. So, our philosophy is that we keep our head cool, be a good listener, There are two things in life. Remember, the moral of this lecture is what you want to say. Welcome, Dr. Shakti. The moral is what you want to say and what the other guy wants to listen. The whole life is a balance between the two. So what I will suggest to my youngster is, say what you want to say in a sugar-coated manner. Convey your message well. If I have to talk to an elderly guy who is diabetic, hypertensive, a bit of renal failure, and is undergoing cholecystectomy, one of the common operations done all across. Every hospital does half a dozen gallbladders every day. So when I talk to the family, I will say, well, the first thing I would say, we would treat him like our own uncle or friend. Second thing, I would say, most of my cases are done laparoscopically, but out of 100, 3-4 of them, under some circumstances of safety, have to be converted to open after preliminary inspection. Never use the word after trial dissection. The word trial dissection, I have seen another senior surgeon friend of mine having a big fight with the family. He used the scientific word trial dissection, but the family interpreted as that they are going to try the dissection on our father. If they succeed, all right. If they don't succeed, they will cut his belly open. So after diagnostic laparoscopy, I will say that we will see whatever is the best for your dad, we will do that. We are ready with both equipment, both techniques. Which suits your father, I will do that. I will also tell him that sometimes there are anomalies of the duct. Sometimes there may be some leakage of bile which may require drainage. If there is a suspicion, I will tell everybody that your patient may require a post-operative ERCP. I will tell everybody, you may have a drain tube here, but this will be temporary. It will come out in a day or so as the leak stops. It is always good to take the family in loop. Most of us, in process of procuring more business or thinking that if I tell everything, the family will run away, we try to talk all goody-goody things. When that does not happen, the conflict of issues come up. That is why the public fights with us. We are an educated, smart group, and we need to act better than the public. And that comes other than the skill. Let me tell you, today also I wrote on one of the articles that after knowledge and skill, surgical skill, communication skill is the third most important thing which decides the future of any surgeon. So we should not try to hide, we should not try to talk pleasant. We should talk pleasant in words, in body language, in our tone of speaking. We should be mild. But I would say very, very bluntly that look, many times I say, well, there is no risk of surgery to this gentleman because we have control over his blood pressure, heart, lungs, everything during surgery. But 5% of these people are likely to develop MACE, major adverse cardiac events. 7% of them will develop lung complications. He may require ventilation for a while. When you tell all these things in advance, then when immediate post-op, if the patient has to be ventilated, number one, your dose of beta blockers doesn't go up. Number two, the family accepts you. because they understand that you had beforehand conveyed the same thing. So this is how you can prevent a difficult situation coming on your head. And if we are smart to talk to, and if we can convince the family beforehand. Good evening, Dr. Bansal. Dr. Bansal is a very bright consultant in our hospital and very academic. We welcome him to this platform. And if we can prevent the unpleasant situation, then the life will be easy for us, for the family, and the conflicts would be less often. So, dear friends, I must share with you my today's experience. I happen to be on one of the moot court proceedings. This was a function held in memory of a senior advocate, my friend's father in Delhi. 57 boys and girls across the country and 9 from international group came to participate in the competition. A moot court was conducted. A case was given which the teams debated for and against the issue, and the real life judges from High Court questioned these young bright boys and girls, and believe me, they were so well prepared. It was so impressive to have a look at it, that how these youngsters who are not more than age of our second professional or third professional people, and such random firing of questions from the judges, and so smartly they were answering. The boy who got the best prize, this was a gentleman called Surya Narayan from Chennai. He was so perfect. His command over spoken English, his methodology to talk, his way he was, carrying his pitch of the voice up and down as required, and his body language were excellent. I just got up and patted the boy. Excellent boy. So what it really gave me a thought process, that look at the advocates, how they are looking after their next generation. Everybody who and who in Delhi court, in High Court and Supreme Court were at the function, blessing the youngsters. If I analyze, we are comparing to them, probably not doing 20% for the young residents which we have. You see, these are the people who are going to carry our profession forward. These are the people 10 years from now, when I fall sick, one of them will be operating upon me. So besides technical skills, we need to develop their worldly skills, their communication skills, their way how they dress up, how they eat, where they drink, with whom they drink. All these things need to be educated to them. Through this platform of LGAs, we have so much of bright faculty. We have excellent speakers with us. I would initiate that all of us should try to train our residents, besides surgery, on the art of communication, behavior, conduct, how to dress up, and so on, so that we have leaving behind us a better generation of surgeons than what we have been. Thank you so much for being with me on this Sunday evening, and let's have a nice week ahead. Wishing all the best to you. Bye.